Okay, so I started that. All right. Well, I'm going to kick us off here. I want to welcome everyone to my Tuesday, Thursday Learning Bites, where we take 30 minutes and we address a hot topic, something great, give you guys some massive action to go take tomorrow and implement. And I have an amazing guest with me, David Newell from OHSU here today. I'm so excited that he is here. I hope you guys are excited as well. And David, are you ready to take it away?
Yeah, you got it, Angelique. Thank you. Thank you for such a kind welcome there. Yes, good to be with you all. I've been on one of these sessions before, and yeah, I'm excited to get to present to you guys all today. And we're going to celebrate the incredible people in healthcare supply chain, our hidden heroes. And as you can see, our title here is Unhiding Your Hidden Heroes. So our hidden heroes connect every supply, every delivery, every process directly to patient care. In September, you may or may not know, we're in our last day here, is Childhood Cancer Awareness Month. And you'll see a common theme here of how this work impacts pediatrics and cancer care and how problem-solving mindset makes it all possible. So I got a little video, but as I kind of preface the video that I'm going to share with you, I want you to imagine a child in the hospital awaiting chemotherapy. If the right medication and supplies don't arrive on time, the treatment is delayed. But because your supply chain professionals solve problems upstream, securing, tracking, and delivering, treatment is able to start on time. This is how your work saves lives. And as you watch this video, I want you to see all of the supply chain connections that are integrated into the patient care experience. You're going to see different products, equipment, things that our value analysis team has been a part of, sourcing, contracting, distribution, right? All these aspects that are related to patient care that our healthcare professionals are a part of. So enjoy this little 2-minute video here.
Thank you, David. Sounds amazing.
Finally tonight here, our persons of the week. So many of us know a loved one who's been tested a setback with their health. But rarely does that test come this early. Tonight here, the survivors and that moment that comes after a valiant fight. Our very little and inspiring persons of the week. It's a big day for baby Wren right there in her dad's arms, walking into that room and right up to that symbolic bell, which signals she's completed her chemotherapy. They cheer her on, and those cheers being echoed across this country. So many hospitals do this when a child finishes treatment.
We want every child to be cured. And every time that bell rings, it's like, you know what? Somebody else has done it.
So many of the doctors and nurses capturing the moments themselves, documenting the bells, the smiles, the triumphs. 5-year-old Peyton beaming.
Ring it loud.
After 844 days of treatment.
It's an honor. It's something that you don't take lightly.
4-year-old Nolan enduring 2 years of aggressive chemotherapy. And just look at his victory lap. That bell at Texas Children's Hospital waiting.
Okay, go.
And at Golisano Children's Hospital in Rochester, New York, Zoe, a 14-year-old leukemia patient, and the surprise serenade.
We throw our hands up in the air today, saying hey-oh, no more chemo.
It was her turn to ring the bell.
I'm just so happy today to ring that bell because I know that I finished it and I beat it and I'm a warrior and I'm a survivor.
And tonight, just look at the picture Zoe sent us. Her smile saying it all. Thanks for that picture, Zoe. And so we choose all of those young survivors thriving tonight and keep ringing those bells. Thanks for watching here on a Friday. I'm David Muir. I hope to see you right back here Monday night. Good night. Finally tonight here, our persons of the week.
I love that, David. That is, I don't know if you guys saw, brings tears to my eyes because I love healthcare so much.
Yeah, it's so amazing, and I'm glad I got to share that video with you.
Tonight here, the survivors, and that moment that comes.
Got a loop going on or something here.
You're good. You're good.
Hold on 1 second. Okay, let's try that. Sorry, resuming the presentation here. So yeah, today I'm excited to share. We actually do have some learning objectives out of this. Three things. We want to connect every action to patient care. We want to model problem solving under pressure. And three, empower our frontline staff to our outcomes. And this is so important because when our staff know their work directly impact their patients, they rise to the challenge. I mean, just that video, right? Like you got to see hand sanitizer, hookups that were on, that child who was going through his chemotherapy, IV drips, right? All of these things are so connected to the care, of course, that's performed. So yeah, a
That's
little bit
supply
about
chain.
yeah, exactly. So a little bit about our hidden heroes, and certainly this is a very short list of multitudes of people that get to be involved in the process. But our colleagues in inventory, distribution, and receiving, they aren't always seen by patients, but their work is vital, right? We prevent the shortages, deliver the blood products on time, ensure there are no errors, no errors slip through. There are hidden heroes behind every successful patient encounter. As far as our direct impact, on patient care, it's not all about boxes or trucks. It's about the outcomes, right? Pediatric IV tubing, like I shared, chemotherapy doses, cancer trial materials, all must arrive without any fail. And when disruptions do happen, it's the supply chain teams that solve quickly. Every solution means a patient receives their care on time. And as leaders, you of course do more than manage supplies. You build resilience, back orders, recalls, shortages, right? These are all common challenges, certainly exposed by COVID-19, but were upon us well before that and will be with us well into the future, of course. And by fostering creativity and anticipation of these things, we can transform crisis into solutions and keeping care seamless for our patients. So what's our practical implementation? Well, I want to talk to you a little bit about the STAR method, right? And these are things that we can apply even tomorrow. And as Angelique mentioned, we do have a, what is it, a big checklist, Angelique? What do you
Our
call it?
massive action checklist.
Massive action checklist. Yes. So I think that will follow today's meeting. Angelique usually sends that stuff out. We've created one for today. But I want you to think about STAR. So STAR, right? So start with huddles and the patient with patient stories, even with your supply chain folks. Track metrics that link supplies to care. We got to do this when we talk about fill rate. Fill rate's an important metric in supply chain, but what does that really mean? That means that the clinicians actually have access to the supplies they need for care, right? And we measure that at a percentage level, right? Ask daily, what problems did we solve for our patients today, right? We can ask even our supply chain folks that, and recognize our staff for enabling care. This is so important. It's well beyond just moving the supplies and finding those things. Find areas where you can recognize your staff and be specific about that and connect it back to the care.
Hey, David, question for you. So you guys, today, you guys are starting with a huddle. Do you guys have a huddle system all the way up your organization or just for supply chain? What does your lean operations look like?
Yeah, OHSU, we adopted some of the GE healthcare methodologies, lean methodologies early on, and now we actually call it OPEX, OHSU Performance Excellence, which does include.
Oop.
Oh, can you guys hear me?
Oh, shoot. Yep.
Can you hear me okay? Okay.
Yep, you're good.
So we have OPEX, OHSU Performance Excellence that includes huddles all the way up through our healthcare, leadership structure. So we have them within our supply chain, of course. Daily huddles. There's ambulatory huddles, pediatric huddles, adult huddles, and what we call like our department huddles. Then it goes to mid-tier huddles, and then up to like an administration huddle, and then even a tier 4 one recently introduced that brings the executives in nursing. So our CNOs are part of that. Our CEO of healthcare is a part of those huddles as well. So there's a pretty rigorous structure here as it relates to huddles here, but you can start it within your department. 4 people. We use a lot of the MES, so methods, equipment, supplies, right? Where we at? Staffing is the other S. Where are we at in each of those areas? What big hits do we have? What quick wins are available that we can tackle today, right? Take back down and solve for the teams.
So, David, we have several suppliers on our call today, and I know suppliers are always watching Learning Bites. What are your suggestions for suppliers to do the same methodology?
Yeah, well, suppliers are obviously we're a big part of the, our supply chain starts, of course, right? So, getting out in front, knowing what issues you're faced with, would be critically important to be able to say, oh, that's a problem for us. What's going to be the downstream effect of that, right? So having those huddles within the teams, that be in the manufacturing or just in the third party facility, right? Bringing those things up to the next level, which could be your customer, right? Us, and informing us about the challenges that we're faced with. Suppliers
Yeah.
is so cool. There is so much connection here. You don't have to be in the four walls of the healthcare facility to recognize that you have impact on patient care. And that's what I love about, the mission that we all serve. And suppliers are part of that. Manufacturers are part of that, of course, as well as, of course, the providers. So, yeah, it really doesn't. And I've talked to many folks. Owens and Miners is our distributor. They are so engaged, with what we're doing to care for our patients. And everybody has their personal experience, right? It's something they went through themselves, a family member, a mom, a dad, a parent, right? A child that they've gone through issues with. So, this does really connect to everybody.
I love it.
So for our leadership reflection, just be thinking about how does your team know that they're connected to patient care, right? How can you bring that into the forefront of their minds and their actions that they're taking on a daily basis? And what solving culture are you modeling? So these questions will certainly help our leadership anchor back to the mission of care, and that's certainly what's important here. And as we close, I want you to remember we may not wear scrubs, but every supply we deliver is a part of the healing process, right? Or supply. It doesn't even need to be on the delivery side, right? I certainly have this picture here, but consider thinking about, right? What is that picture of that child or person ringing that bell, right, after completing their cancer treatment? I certainly hope that video was inspiring for you and gave you a smile as you're watching the end of their care coming to a close, and just the excitement that's there. It's supply chain that helps make that possible. So
Yeah. Hey, David, has your team ever gone up for bell ringing so that they can kind of experience it and kind of be a part of it as a team?
yeah, great one. We have not done that as a team, Angelique. We've kind of had little micro pockets, and that's been really helpful. One of the things that we have done is leadership rounding. So we've actually had the chief nursing officer come to our huddles, our department huddles, and share with us about the impact that we're having. And that's an amazing experience for our frontline staff. Connecting it the way that you are, I love it. Yes, let's get up there and be a part of that, ringing the bell moment, right, for our folks.
Yeah, and I'll say we've actually moved that into our interviewing process of our team, really thinking about, hey, are you coming to work here kind of for a paycheck? Or are you coming to work here because you feel it's part of your purpose? Like, I always tell my story that my mom passed away in 2008, and I found out later, after she had a massive brain aneurysm, that she couldn't afford to get care. And my dad had died 15 years earlier, and he was the breadwinner, and he carried the health insurance at his work. So my mom was out in the marketplace trying to get health care. It was very, very expensive at the age of 64 to try to find health insurance on your own. So she really had health insurance for just in case emergency. And so she had very high blood pressure that she never had checked. And so she felt like I'm perfectly fine, and blood pressure is a silent killer. And for her, obviously, that cost her life. But I always think in the back of my mind, how many people are sitting at home today, not going to get care because they can't afford it? And how many people in their hearts have a story like mine that is either as a family member, a friend, a neighbor, where the actual passion of healthcare is in your heart for a purpose, that you want to make sure you're helping to bring down the cost of care, helping to make sure all of the patients in our community have access to care, and they're not afraid to come in because it's too expensive and things like that. And I always try to share my story to be vulnerable with my employees so that then they feel like, hey, I've got a story that I can connect to healthcare as well. And it just kind of fuels your passion at work. And I feel that as employees have come to me to share their story, it really fuels them in just movement every day and getting the supplies to the floors and doing what they do. So are you finding that within your team too, David?
Yeah, absolutely. I mean, the more you can share the story, right? Like people just connect to that, right? And the whole purpose in sharing story is then to also receive story back, right? And so, it compounds on itself, right? Where you get to talk about your experience and you get to listen, right? And that's an important part of leadership is how we listen to others, right? And those connections trigger things for us. Oh yeah, hey, that does have a connection to what Angelique talked about, about reducing the cost of care. Guess what? I see some waste here. There's time in this, space where we're delivering these supplies. We could actually make that more efficient. Let's work together in those activities, right? I mean, I think we've got
Yeah.
amazing suppliers that really do go out in front and really try to find ways to be creative to I mean, bulk buy opportunities, right? That's a great way to look at it. Go, okay, if you have the capability, if you buy at a higher level, we don't have to ship as much to you. We can be creative about where the savings is that doesn't actually, impact the bottom line of the supplier, and it does actually reduce the cost of care for our patients, which I think we're all into when we really break it down. So.
That's true. All right, tell us about your massive action checklist for the team today.
Oh, great. Yeah, I did not pull that up. I don't know if you have that and want to share that,
I
but
sure do. I can share my screen with it.
yeah, I'm excited to share this with you. So there are some things on this, just full disclosure. As I got to develop this in hand with the presentation, I was recognizing, hey, there's some opportunities for me and my team that I can start to implement, right here, right now. And there's some things that we have been working on. So, this checklist isn't just me saying here's all the things that we've done, but it is that resource that we can utilize and share in together. And I would say a big part of this, it doesn't have to be linear. Grab something today that you want to take and use and implement, right now. So you don't have to do the first three bullets before you can move to the fourth. I got to share a little bit about the metrics and the fill rate. That was like a great moment for us where we shared that in our staff meeting, and it really helped connect. Oh man, not only do we obviously work on our raw fill rates, adjusted fill rates, working on what supply substitute that we're handling, getting to infuse in the system, how we actually impact our fill rate from our vendor and enhance it with our substitute item or make something more available, right? So you start to take it from what could be a small team that's focused on that number to really going across the system, value analysis, our contracting team, our inventory team, all the way, of course, through distribution. So yeah, that's certainly an important one. I love this middle line, this celebrate the hidden heroes. So really do try to find, three individuals on your team who help solve problems. And I put this in here quietly, right? Because that's what happens. That's what we do. And a lot of times in supply chain, you just go, well, yeah, that's what we were supposed to do, and that's suppliers do that, our vendors do that, we do that as providers, of course, too. but recognize those things, take a look. Publicly recognize them in your next huddle. You got to know your people. Some people are really going to be okay with that, and others, may shy away. And certainly you don't want to hinder that. Some people do like to be recognized more in private than public. So, you certainly need to consider that. I love this hero wall. I have not started this, or digital board that highlights the problem solvers and innovators. What a great way to keep our folks engaged and to set the culture, like you said, Angelique, as you hire people in, you get to show them, right? A virtual hero wall, or who's doing what in an organization and how we recognize those things. I got a little bit more time. I can keep going. As you can see, I'm super into this project, or this mission here, connecting to the mission.
I love it. Keep going.
Yeah. If you could scroll down just a little bit more, I just want to do that close with inspiration here. So, like we talked about, I really do challenge you, take a patient story, right? And take that into your next leadership meeting to ground the supply chain and the mission. For those that work in healthcare and those that interact with healthcare, just go to your webpage or go to the provider's webpage that you work with. You will see and easily grab that information and share those stories. Keep an eye out for what's happening with your family and sure they're okay with you sharing, generally or in some cases specifically about what their experience was.
Yeah, you don't want to get
making-
any HIPAA issues.
Exactly right. Exactly right. For sure. Try to really make that patient connection a standing agenda item in your staff meeting. That's going to be a real important part. And Angelique, I love that part, that challenge that you had. What's your department doing? How are you, going up to see the ringing of the bell, right? How do we line the walls, when we get to celebrate those sorts of events? And then challenge the leaders to, of course, do the same in their team. So, don't just stop with you. You get that challenge out there.
I love it. Okay, so team on the call. First of all, any questions for our amazing guest that we had today, David, or comments? What are you guys thinking?
Hi, Angelique and David. Gosh, my favorite part was when you mentioned passion and purpose. And I think what's really special about that is it really doesn't matter what your title is in the organization. Those two things at the human level are what really drive us.
So
Yeah,
true.
truly.
True.
Yeah, that's really good, Heidi. Anyone else? Sydney, I know you always have something to say.
Always coming off mute. No, this is awesome. I have my own story of my son when he was a year and a half old, was in and out of the hospital. So I wasn't in healthcare at the time and never thought I would be in healthcare. And then kind of fell into it like a lot of people in supply chain, I hear do. And really it's just the heart of healthcare that keeps me in it and keeps me passionate. And I think, like you said, it applies to suppliers just as much as it does to providers. I hope for the most part, and it's just an awesome mission. So thank you for sharing all of this with us and continuing these learning bites. I love them. You know me.
Yay. Okay, well, David, you've been amazing and you're literally reminding us of who we are because I don't think we take enough time during the day to remind ourselves of that. And what I really want to just say to everyone out there listening to our Learning Bite today is stop and reflect and remind yourself because if not, you're going to get caught up in the firefighting, the day to day overwhelm a lot of times in healthcare supply chain, lots of overwhelm. And I don't want you guys to get caught in that. Also, please remember in October, right? Healthcare Supply Chain Week is coming. It's a great reminder to celebrate your teams out there, suppliers and health systems. Please, please, please take the time to recognize your team and do something amazing during Healthcare Supply Chain Week.
That's how
Okay.
you uncover those hidden heroes, Angelique. Well done.
That's right. Well done to
Absolutely.
you, David. Thank you so much, everyone, for joining us. I hope you guys enjoyed having David with us today. I sure did. And thank you, David, for all your wisdom. We appreciate you.
Yes, thank you so much for having me.
Okay, bye, everybody. Have a great day. Thanks, David.
Bye.